Hey, we're recording. No curse words. So good afternoon, everyone. My name is Bill News, and I'm an education consultant for Accurate for Government. And this is the fourth quarter call for the DHS working group or the Public Health Working Group. We're recording this call for those folks that aren't able to attend. I wanted to thank you all very much for taking time out of your day to attend. Hopefully we have some information on here that will benefit some of your job responsibilities going forward, and if nothing else, pass on some educational information so that you can be more responsible in your daily routine of doing the work that you're doing so diligently. So for those of you that are new to the working group has been going on for about 5 years, and it started with, I think, 6 states and about 15 people, and we now have I think there's about 28 states incorporated with over 120 people that are partly members and just part of the organization. I don't expect ever to see all of those people on, and I know that everybody is super, super busy right now. So we're recording these so that they have an opportunity to read them or go through it later on. The first thing I want to do is thank all of you guys that are out on the front line trying to get rid of this thing. And as we all read the newspapers, which I try to slow down on because I get heart attacks, obviously there's a spike going across the country that's shutting down a lot of things. So I thank you all for being out there and continuing to do what you do. If there's anything that we can do, as the second bullet point addresses, if there's anything that you think we can do with our data, 85 billion records, please reach out. I'll be more than happy to either move that idea forward or put you in front of the right people that will be able to help you. Right? I'm dealing almost exclusively in the last 6 months, spent probably 80% of my time dealing with nothing but Department of Health agencies and in more particular, those people that are doing contact tracing, either on the batch side, where they send us thousands and thousands of records, or on the individual side where they're trying to reach out and trying to locate cases and or contacts, and they have some lacking information that they use our system to try to go find. Okay, so just a little bit of the agenda. I am going to go through some information that I received from the CDC on a program that they are calling Traveler Planner or Travel Planner, and it's a pretty cool concept. And hopefully some of you have already seen or heard about this, because I did speak with them and they said that they've been passing the information around to a lot of Department of Health agencies. I told them that I have this platform that I would be more than happy to introduce it to this group, and they said go right ahead, feel free. So I'm going to take a few minutes here and go over this Travel Planner program, pass on some interesting information that will hopefully go from you back to your agency if they're not involved with it already. And then we also have Diana Suskoff, who's one of our newer market planners, and she's going to join us and talk about some of the projects that she's working on and give a little bit about her history as well. So here's some narrative for you, and I'll just go through this. But on the 19th of October, I sat through a webinar that the CDC put on about a program called the Traveler Program or Travel Planner. And I learned about it through the CSTE organization because I'm a member there, and I saw that this webinar was being held, and I'm like, oh, this would be pretty cool. I probably need to know and understand what this is all about. Sat through it was probably about 20 minutes of a webinar, learned a lot about what they are trying to do, and as you can read there on the screen, they're trying to create a singular platform where if somebody is going to travel, especially in the next week, right, it's going to be crazy travel time. Somebody's going to be traveling from point A to point B, they may need to know what the rules and regulations are for point B. And if they have to make a diversion or a tangent on the way to point B, they may need to know what those requirements are going to be. So what they're asking the individual Department of Health agencies is to register through a secure system into the Travel Planner program. It takes about 15 minutes, and the example that I sat through on that webinar literally took about 10. I didn't even take the 15 minutes. and fill in some information. I'm going to go through some of those items now. So these are some of the questions, or these are the 7 questions that will be presented to you as the input individual for your particular agency, your particular county or state Department of Health. Are travelers being required to self-quarantine? Do they need to submit contact information? Are there any testing requirements for the travelers? And if so, how are they providing their results? Is there a mask mandate? And if so, what is it? Are there limits on gathering size? What do travelers need to know? Are any destinations or business closed to travelers, such as beaches or restaurants or bars? And I think today's Thursday. Tomorrow, Philadelphia is going on a new lockdown, which is probably going to result in a lot of angst and probably result in a lot of places being closed, a lot of restaurants being closed, because it's about 30 degrees here today, and I can't imagine anybody wanting to go outside and sit outside and eat. And then obviously, who should travelers contact if they have any COVID-19 symptoms? So those are the 7 questions, pretty straightforward. If anybody on the call is responsible for that input, you may already know those answers, and if you don't, then there's probably resources at your agency to get those answers so that you can fill out this, and then you'll become part of their platform. And here is that key information to get the SAMS account. And SAMS stands for Secure Access Management Services. And I'm reading a document here that says once you are registered with CDC's SAMS program, the travel planner portal, inputting your health department's information should take less than 15 minutes. What else is here? The email address is right there. You have to send an email to that address there and ask for access to it. I tried to do that, crazily enough, because I thought maybe they would just let me get one, but it's only available to Department of Health agencies. It's not available to me as an employee of a private company. All right, so it's available for you guys and not me. And here's what the screenshots look like. Now, the person I was working with or that ran the webinar was in Atlanta, because that's where the CDC is, and I assume that's DeKalb County. So you can see here all those questions that are here. Is there a mask mandate? All those questions are right here. You just fill it out as anything else. The second page of it, now it looks like now he's filling it out as Fulton County. Messages, you can put messages on there. Apparently you can put badges on your own website. If I'm going to be traveling to Atlanta, I may need to know, and I may be diligent enough to reach out and say, I wonder what I need to do when I get to Atlanta. And if I go to the Fulton County Health Department, you can put a badge on there, and this platform will pop up on there so that you don't get the phone call. You don't get the contact us information or request from people that might be traveling from Philadelphia to Atlanta. Okay, pretty straightforward. And here's the health information, the health department information. All right, Gwinnett County Health Department, the address. I assume that's the fake information, but maybe not. Yes, it says right here, do not include personal numbers, email addresses, so on and so forth. You travel need to submit. And then whatever your answers are is what's going to pop up if, in fact, I'm going to be traveling to Fulton County and I want to inquire, what do I need to be aware of if I'm going to travel to Fulton County? So it's a pretty cool aspect that they're doing, especially now certainly now and Christmas, a lot of traveling going on. They want to keep ahead of this. They want to inform citizens as to what they're responsible for, what they need to do when they're going from point A to point B. Okay, let's see if there was one more. Oh, okay, so that is the only information I have for the CDC travel planner. If anybody has any questions on that, I have a letter from them that I can forward to you. You just shoot me an email and I'll be more than happy to send it to you, and maybe I'll even include it as attachments on this recording at the end. But the attachments are literally that PowerPoint that I just went through, a 2-page letter, and then there's another longer document that I didn't really get a big chance to review. But any of those documents that the CDC is putting forward, I will be more than happy to attach onto this recording. And now, okay, so let me see if anybody has any questions concerning that before I introduce Diana. So maybe we'll save them to the end if anybody has any, not a problem. So without further ado, Diana Suskoff is going to jump on, and Diana is one of our newer employees. I'll let her introduce herself and give her background and her goals and objectives as a new employee in the product development team, and I will go mute. It's all you, Diana.
Hi, thank you, Bill, and thanks so much for having me on your call today. I am a director of market planning at LexisNexis, which is actually a little bit different from product development. It's more around kind of strategy, and wanted to introduce myself to you guys. Bill asked me to speak a little bit about my background as well, because I'm actually a public health professional, so I'm very familiar with the work of everyone on this call. And wanted to just share a little bit about, why my role was created, which was very much with the vision of expanding our support for government healthcare agencies. Wanted to share a little bit of background there and give you a little bit of insight, and also would love your feedback. So I did, before I kind of jump in, just wanted to again say, please would love to connect with you. My contact information is on the slide, and Bill has it as well. Would be more than happy to answer any questions, hear any brainstorming, any requests, anything like that. And I would love to at some point use this group as a little bit of almost like a focus group for how we can help support public health departments. So my background, my past 10 years or so have been focused on the intersection of public health and Medicaid. I have an MPH from UNC, and I always mention that because there's probably at least one other person on here who's a Tar Heel. So I worked as a public health consultant for Massachusetts and North Carolina and CDC on a number of different projects. Most of those were oriented around health communications and program evaluation. I then led healthcare strategy for Text for Baby. If any of you guys are familiar with that, it's the country's largest mobile health program for pregnant moms and new parents. So that was a really, really interesting opportunity to kind of talk with public health, but also be in a private company and really innovate a text messaging program that started in 2010 at the White House. I left that role about a year ago, but it was very, very critical to sort of how I think about the intersection of public health providers, health systems, and Medicaid and private companies. While I was, in that role, I actually took Text for Baby and created a whole portfolio of different text messaging programs that were all focused on, public health goals. So high needs populations, was very, very focused on using text messaging as something that's really high reach, really low cost. If anyone has questions about text messaging, happy to talk your ear off about how it can be used in public health. And so, in that role, spent about 6 years there really developing, again, programs for maternal health, for diabetes management, for appointment reminders, all kinds of things like that. And in that, I spent a lot of time with Medicaid health plans, with Medicaid state agencies and departments of health. And those are kind of the three areas that I enjoy focusing on. And actually, was really, really interested in how can you, now that I was spent, 6-7 years building programs, was very focused on how can you better target those programs and what data is out there, either to get better contact information or to get better demographic information, or better for Medicaid and public health at the federal, state, and local level. And then what that means is really thinking about how do we use the assets that the data that LexisNexis has and use it, for a lot of the work that you all are doing. So certainly contact tracing and all of the services that Bill has trained you all on is an aspect of that. But there's a lot of other types of data that we have that I'm particularly interested in kind of seeing what the applications are for public health and for Medicaid. And one of the biggest ones of that right now that I'm focused on is around social determinants of health, using some of the databases we have. We actually have a clinically validated predictive model and scoring around 500 different social determinants of health. So I'm sure that's a term that's very relevant for a lot of your work and something that probably your agencies are very focused on. And so that was really what brought me to LexisNexis, was the interest in using that data for that. Some of the other projects that I'm working on are also looking at how we can support data management and data management for research and for evaluation. We've got a number of different capabilities and data sets that we're already kind of using. But again, that's something I'm going to be working on in the next couple months here, is to really focus how they can help public health evaluation and program development. And another area that I have been really focused on, and again, see a lot of relevance for public health and something we're going to be investing in next year, is around patient matching. So you may have heard there's a lot of movement right now in healthcare to just do a better job of understanding how to match different people, how to make sure you have the most up-to-date data, and how to make sure that those efforts, whether that's tracking COVID testing or contact tracing or immunizations, or whether that's tracking other types of healthcare services, making sure that the data is matched correctly, sounds very simple, but is actually a very, very complex process. So those are, again, some of the areas that I'm particularly excited about and focused on. As I mentioned at the beginning, I would love nothing more than to get your feedback or questions if you have them. If any of that sounds interesting or you want more information, would be more than happy to talk with you more. And also, again, would love to continue hearing about the work you're doing and staying connected to public health interests around this area. So with that, I think that's it. Unless there are any questions, I'll hand it back to Bill. And thank you again for your time. It's great to meet all of you.
Great. Thanks, Diana. And if anybody has any questions, they can certainly unmute their phone and jump right in and ask away. If not, there is a chat box capability in the top right-hand corner, and you can certainly feel free to go up there. And I did have one follow-up for Diana, and maybe she can or maybe she can't talk about this, but you had mentioned recently that you were doing some work for NIH, and I'm wondering if that's something that you could expound on a little bit.
Yeah, I am happy to. So we do support both federal, state, and local healthcare and public health. And so one of those projects, as Bill mentioned, on the federal side is supporting some work at NIH around cancer registries. And that's where we're actually providing a number of different data sets around previous address, social determinants of health. And there's some researchers there who are using that to look at how do families of children affected with cancer, how does that impact their financial health? How does that impact their migration? Does it mean that parents are, after getting a diagnosis, changing their residences? Are they moving across the country? Are they moving towards centers of cancer excellence? So that's an ongoing research project that we're really, really excited to support, and a perfect example of how we can provide some of the data to fill in those gaps for researchers looking at different social determinants around a health outcome.
Excellent. Thank you very much. And to finalize and to close out, Tom Tamplin is on the phone, and I'm going to unmute Tom right now. And Tom is one of the active salespersons at LexisNexis Risk Solutions, and Tom has been working with a lot of Department of Health agencies. And I was hoping that Tom would be able to share some of his examples, some of those conversations, why they're coming to him, and what kind of solutions is he offering them that help move their cases forward. And again, a lot of this is based on contact tracing. All of us have been spending a lot of time in that world recently, and I'll ask Tom to spend a couple minutes with us and go through some of those. Tom?
All right, perfect. Thanks, Bill. As Bill mentioned, my name is Tom Tamplin. I am with LexisNexis. I'm the account manager that covers all the Department of Health and Human Service agencies throughout the southeastern United States. Bill had asked if I could share with you some examples of my customers that I'm working with where they've had successes. So one of the things that really stood out to me that I thought could be helpful is one of the agencies came up with the concept of their workflow of contacting individuals by emailing them first. Just before our call 15 minutes ago, I literally blocked a phone call from Texas about my car's extended warranty. Well, we're calling people remotely. We're calling from cell phones. We don't recognize the phone number. If they're not leaving a message, that phone number is getting blocked. So what they said they had success with was, hey, we're going to send a soft email first. So they go into Accurant, they look for an email address, they send an email saying you will be contacted by blah, blah, blah Department of Health. Please answer the call. Their success rate went up over 83% of contactability via phone. So it's inexpensive to find an email address. It's very effective, at least for them. If that's the one of the really cool things you take away from this, and it helps you achieve your connectivity a little bit better, I thought that was amazing. Also, for smaller counties, literally in July onboarded. I want to say there are 67 counties in the state of Florida, each one of them setting up their own Accurant accounts with their own users, and the number of users is based off the population. What they found very successful is in Accurant, under the bottom left-hand side, there's a More button. In there is the online batch wizard. And for the smaller counties that don't have a lot of employees, some of the end users, the epidemiologists, they cover maybe 3 counties, right? 1. So when they get large volumes from multiple counties, it was just crushing them to try and do all that contacting. So they're using the online batch wizard, and the functionality is called real-time phones. So they don't have to do 250 searches in Accurant to get a cell phone number. They upload the file and they get the output back, and they can start calling and dispersing those people out. It's just a huge time saver. Those were some of the things I thought that would be really important to share. Also, we partnered with the CDC, and I want to say it was Johns Hopkins University, and we have a COVID-19 LexisNexisRisk.com resource center. It tracks the positive COVID cases by counties. So you can dive into your specific state, your county, and look at the number of positive cases, how they're trending, things of that nature. Hopefully, maybe when Bill sends this out, he can include that link and a little information about it as well. But at least in Florida, where we had the first hotspots coming on, they found that resource very helpful. So hopefully you will too. Those are the 3 main points that I thought I would like to share that would benefit you all. So hopefully you find that helpful, and thank you all for your time.
Great, thanks, Tom. And I will send that link out to that marketing piece, and included in that marketing piece is a link to the upcoming contact tracing classes that I typically run. They're about 30 minutes long. Obviously, they're free. They do not need to be attended by anybody that only has access to Accurant. You are more than welcome to attend, even if you're just somebody in the office and you need to understand what Accurant is all about and what our data can do to help you locate people. I know up in New York, we have, I think there's 110, and New York State is bringing on triple that in the next couple of days. Philadelphia is doing the same thing. So I think I'm going to be busy between now and Christmas, which is perfectly fine. Because again, back to my second slide, think about spring baseball. And the only way I'm going to get to a baseball game is if we get ahead of this. So does anybody have any questions at all that they would like to present to the group? Or does anybody have any problems that they're having in their own individual agencies that you would like to present, that maybe someone else that's on the call? We have about 15 people on the call, that maybe someone else in one of your other sister agencies in another state might be able to help you move that forward. And that's kind of the whole idea of this whole working group, is to allow folks opportunities to present problems or issues that they're having, so that maybe someone else on the in the working group has a solution, or at least can agree that that's a problem, and maybe there's something that we can help out with. It's not all a sales call. It's educational exchange platform. So anything? Michael, Becca, anything from you guys down in Austin there that might be able to help out the group? No pressure. All right. So
nothing that comes to mind.
Okay, that's okay. That's not a problem. And again, the whole idea, the whole genesis of this group was to allow Department of Health agencies to share, not necessarily, you know, inside proprietary information, but practices, and try to get to the point where if something's happening in New York, it's probably happening in California, which means it's probably happening in Texas. So
I have a question.
The whole idea of the platform. Sure. Is that you, Michael?
Yeah. So y'all mentioned that y'all saw this 83% increase in success rates for people who were contacted with soft emails. What were, like, do y'all have a template of like the soft emails that you were sending? I think that would be useful.
Let me unmute Tom again.
No, they did not give me an example of what their email was. They just explained the concept, and it was simply, please, you're going to be contacted. This is COVID related, and please answer the call. And that's where they got the increase. So I don't like have a Word document of like a script or anything that they did or put in there. That was just the premise of what they were doing, and they said it was very successful. I wish I had something that we could share as like a template format, but they didn't provide that to me. They just kind of talked me through their workflow. So we've done things like that with the State Department of Health in Florida, and we actually built them a custom batch, and it involved pulling the email addresses as well. I don't know what the state, what they're at the state level, what they were doing or what the email messages looked like. I do know that that was part of their workflow, and that was some of the raw data we were putting the state epidemiology staff in Florida.
Mm-hmm.
Okay. Thank you.
Yep.
Yep, no problem. Thank you, Michael. And lastly, one of the things that I learned from the contact tracers that I was working with over the summer, but it's still present and prevalent, is you have younger kids that were going to these, supposed COVID parties, right? And giving it to each other as if it was some sort of badge of honor or something. And they're 15, 16 years old. And the problem is when that contact tracing starts taking place, you're looking for a 15, 16-year-old, and you're thinking you might find some information about that child inaccurate, and you're not, because we can't display anybody who's younger than the age of age. However, that phone number is registered to somebody, and it's probably the guardian that bought the phone for the child. So what we did learn was that when you have these family plans that Verizon and Sprint and all the cell phone providers are offering them, you have a family plan, and the example would be dad goes into Verizon store and buys 4 phones, and he walks out with 4 phones and 4 new phone numbers, right? And he goes home and he distributes them. He gives one to his wife and him and his 2 kids, 15, 17 years old. Those kids are going to use those phones like every other 15 and 17-year-old uses them. But if that phone number ends up on a list of somebody who's doing contact tracing, the phone number is going to appear to belong to the father, right? And then you're going to try to, or the tracer is going to try to call and say, hey, I'm looking for John Smith Jr., and you're going to have John Smith Sr. on the phone. And however that person's going to treat the tracer is going to be however that person's going to treat the tracer. Sometimes they're nice, sometimes they're not. I've heard some very, very good stories, and I've heard some horrible stories from some of the contact tracers that I've been dealing with. But that's an issue that we weren't really aware of until one of the contact tracers contacted me and said, I don't understand what's going on here. I'm getting so many phone numbers back for this one address. And then we realized that a lot of it was because 1, the child's below 18 years of age, and 2, it's in a family plan. And some of those family plans, I think they allow up to almost 5 phones, 5 different phone numbers and 5 different phones for a family plan. And that becomes a big issue. It becomes a brick wall for those of you that are trying to figure out, where can I find this 17-year-old? And maybe Tom's example of shooting a text message and saying, hey, we're going to be dialing you in the next couple of days. please answer the call, maybe that's something that will help. Because I typically, and I'm very cautious, I typically don't answer phone numbers or phone calls from numbers that I don't understand. I've bought like 12 different auto warranty programs right now, just joking. But they're all coming from them, right? So when they see that and they don't recognize the number, they're not going to answer the call. But if they get a text message that says proactively, hey, we're going to be reaching out to you, not a big deal, just answer the questions, obviously it's had some positive impact. All right, so those are just some of the things that we're learning dealing with customers. I will continue to run these classes. And again, that link to the upcoming classes is, will be on that marketing piece that I'll send to the attendees and to the whole group. And feel free, reach out, don't get headaches, don't get frustrated, call me, email me if there's something that I know of after, so I've been in the public record world for 25 years. I might know one little tiny thing that can help you resolve a big issue, and I'm more than happy to share that. So with that, and I don't see any questions up in the chat box, I will let you guys have the rest of your day back. Thank you very, very much for your time. Appreciate it. And be safe. Thank you.
Hi, thank you.